Thank you for joining us today as we discuss coping strategies for anxious students and how parents can help. We know this is a busy time for everyone, and we appreciate you making time for this session. My name is Cindy Grohl, and I'm a school social worker with the Metropolitan Nashville Public Schools Social Work Department. The school social workers in MNPS work with students and families and help connect them to appropriate resources inside and outside of school, as well as provide counseling to students during the school day. Today, I will discuss with you the signs and symptoms of anxiety, and my co-presenter, Jessica Bell Blackshear, who is also a school social worker, will join us later in the presentation to discuss how parents can proactively help their children who are struggling with anxiety. So what is anxiety? Anxiety is reaction to situations perceived as stressful or dangerous. It's our body's natural response to stress. It's a feeling of fear or apprehension about what's to come. It's a physiological, which you feel in your body, a psychological, which you think in your mind, and behavioral reaction all at one time. Anxiety is treatable and manageable. And what I mean by that is a mental health provider can help you develop the appropriate treatment plan for your child's anxiety and teach your child effective coping skills to manage his or her anxiety symptoms. Anxiety is sometimes spontaneous, which means it can happen out of the blue and for no reason. It can be situational, such as test anxiety, or it can occur occasionally or frequently. Anxiety is in a level of anxiety is on a level of intensity from mild to moderate or to severe. So there are various symptoms of anxiety, which include obsessive fear or worry, rapid or trouble breathing, sweating, feeling weak or trembling, increased or rapid heart rate, feeling a sense of impending danger or panic, trouble concentrating or thinking about anything other than the present worry, feeling weak or tired, or having trouble sleeping. What are the causes of anxiety? There's 4 main factors that contribute to anxiety. The first one is biological factors, which would include genetic link, say from a parent to a child. Children who have parents with anxiety may also have anxiety, which is passed on down. Medical factors is the next factor, which is related to health conditions that somebody has, such as thyroid disease or heart disease. Sometimes health issues can cause anxiety. The next factor is trauma and environmental factors. A child who has been a witness to trauma or has experienced trauma can experience anxious symptoms. Environmental factors are those factors in a child's environment, such as their home, their living situation. So if they've experienced a death in the family, divorce in the family, maybe they've moved schools, all of those things can cause stress. The virtual learning environment that we're in right now can be stressful and create anxious symptoms for some students and families. And the last factor is psychological. Psychological has more to do with thought patterns that can create or increase overwhelming emotional feelings. So what does anxiety look like? Anxiety looks different in different age groups. In the preschool age child, you may see increased fear of being alone, increase in bad dreams, increase or changes to or loss of bladder or bowel control, maybe some bedwetting, changes in appetite, increased temper tantrums, whining or clinging behaviors. The school-age child, ages 6 to 12, may show irritability, whining, aggression. They may have sleep issues or nightmares. They may have appetite disturbances. You may see physical symptoms with a school-age child, such as headaches and stomach aches. They may withdraw from their peers or have a loss of interest in things that they normally enjoy. They may compete for parents' attention or be clinging towards their parents. They may avoid class or cut virtual school. So what does anxiety look like in teenagers? You may see with teenagers physical symptoms such as headaches, stomach aches, rashes, sleep or appetite disturbances, agitation or decrease in energy, apathy, kind of a no-care attitude. They may start to ignore healthy behaviors. They may not have good sleeping patterns, not eat healthy food. They may have more concerns about stigma, as far as personal stigma, or injustices as far as things being fair, if they feel things are not fair. They may avoid or cut virtual school. And now I'm going to turn it over to Ms. Blacksher, who will talk with you more about coping strategies.
All right, thank you so much. So how can we help our child or children cope with anxiety? Parents can help with their child cope with anxiety by doing the following things. Let's first start with education. Educate yourself about signs and symptoms of anxiety. The next one is learning ways to help your child cope with anxiety at home and at school. The third thing is seeking professional help as needed with a trained mental health provider who can work with a child and parent on strategies to manage anxiety. Next, listening to your child and allowing him or her to express feelings. Being flexible while trying to maintain a normal routine. Modify expectations during stressful periods. Staying calm when their child is nervous. And last but not least, recognize and praise for those small accomplishments in managing anxiety. Baby steps are definitely worth to be praised. So, what are coping strategies for anxiety? First, we have relaxation techniques. Learn how to acknowledge feelings, practice good time management, set healthy boundaries, physical exercise. Yes, it's very, very important to get out and get moving, even with a simple walk. Recognize perfectionistic thinking. A lot of our kids are overachievers, so please let them know that it's okay to make mistakes and it's okay. We're in this together. Quality nutrition. Don't forget about those veggies and fruit, and most definitely do not forget about drinking water. Talk it out with this trusted friend or adult. Talking with someone is very important. Positive self talk, deep breathing, mindfulness. I know the first week of school, our students were able to learn a lot about mindfulness. Take time outs, self nurture, get plenty of sleep. Sleep is so important. Sleep has a lot to do with our mood, and it has a lot to do with how we focus and how we can focus, rather. Reduce stress the best way you can. And last but not least, grounding techniques. So, here are tips as it relates to COVID-19 and how to manage stress and anxiety. We are in this virtual space, unfortunately, because of COVID-19. So, the first thing we must do is remain calm. It is important as parents that we try to remain calm. It's important that we use those coping skills that I just mentioned, that as parents, as adults, we have to use those same strategies. Okay. So just make sure you keep your anxiety in check, or at least work on making sure that you demonstrate to your child or children how to cope with stress and how to cope with anxiety. The next tip is lay a foundation, and this is in regards to communication. Basically, make sure that all lines of communication are open, completely open. And it's okay to find other topics to talk about. We can talk more about life than COVID-19. So be able to talk about other things, good and bad, but just don't talk about COVID-19. Um, and try not to minimize concerns of our students and our kids. If they have a concern, please be there. Do not avoid their concerns. The next tip is be honest and accurate. Keep updated about what is happening from credible sources. And don't be afraid to discuss COVID-19 and how it spread. The next tip is be reassuring. So basically, just continue to support your children, support your child in this time of COVID-19. Most importantly, this is a time to always feel free to bring up safety concerns. The next tip is create a plan for safety. And so when it comes to safety, make them feel empowered or empower and encourage our young people to continue practicing social distancing, wearing a mask, and washing their hands. So basically, empower our students, our children, to have good hygiene. Tip number 6, avoid blame and look out for stigma. This is not the time to blame anyone for COVID-19. Let's just stick to what we know. Let's stick to the facts and just encourage your children to spread kindness and support. We are all in this together. Tip number 7, stick to routines. Structure each day, even if your district is doing virtual learning, which we are doing that. So stick to the routines, but let's make sure that we are sticking to it because kids love structure. And most importantly, please be mindful that our students, our children, have a scheduled meal times are in the schedule, as well as bedtime. That's right, bedtime. Our students, we want to make sure they're getting plenty of sleep before the next school day. Being virtual can be taxing to the body. So it is important to get, once again, to get those meal times in, as well as bedtime. And how did I forget to mention? Manage screen times. That is very important. Making sure that our students are not on the screen 24/7. And last but not least, be developmentally appropriate. Make time to talk and be available when your child wants to talk, and make sure it's age appropriate. So where can I get help for my child's anxiety? Let's first start with your school. Your school counselors are waiting for those referrals. So please contact your school counselor to help with your child's anxiety. From there, the school counselor will connect you as the parent to the appropriate provider within the school, or if appropriate, can provide information on who to contact outside of school. So that contact may be, or that referral may be to a school social worker, it could be to a school psychologist, or it could even be to the school counselor who you contacted originally, and it could be a school-based provider such as Vanderbilt, as well as Centerstone. In terms of the community, there are many therapists in our area who provide therapy for children with anxiety as well. You can consult with your school social worker or school counseling department, which can also assist you with finding a provider. The good news is if you have insurance, you can also contact your insurance provider for help connecting to a therapist. All you need to do is just look on the back of your insurance card and call that number there and ask to speak to the mental health department, and that person, that representative, should be able to give you a variety of names and numbers of therapists in your area or whatever area you prefer. Anxiety resources. Now, there are tons of anxiety resources out there, but these are just few that we have available for you to consider. The National Child Traumatic Stress Network, which we were able to get a lot of our information from this organization. And then you have the CDC. Of course, you can get information regarding COVID-19 from there. And then we also have worrywisekids.org. So I only mentioned 3, but as you can see, there are many resources that you can refer to. All you need to do is just Google anxiety and you'll get a whole lot of information and resources. But most importantly, you start with using your resources in the school, and that is contacting your school counselor. We hope that you have enjoyed this presentation on anxiety. And if you have any questions, concerns, feedback, please do not hesitate to contact family support at mmps.org. Once again, if you have a concern, question, or would like assistance, please email family support at mnps.org. Thank you so much for your time.